of the Climate and Health Advocacy Bootcamp being hosted by the Global Consortium on Climate and Planetary Health Education and the Medical Society Consortium on Climate and Health. So we've done one session on finding your story, and then last week we heard from our media experts. We're really excited this week to be talking about one of the most important climate actions every one of us can take, which is participating in voting. Just as a reminder, the readings and the recordings will be available on the website, and we'll be dropping the link in the chat right now. Remember to please put your name and location into the chat. Please put all your questions for the speakers into the chat. Please remember to keep your microphones muted during the presentations, and we invite turning your cameras on because it makes it more engaging in terms of the session itself. I'm really excited to introduce our three speakers. I'll put the bios for each of our esteemed speakers into the chat because I can't do it justice in just a short time. I just want to leave them time to actually share their wisdom with us. We're going to be joined by Nathaniel Stinnett. He's the founder and executive director of the Environmental Voter Project, Alia Bhatia, who's the CEO of Vote ER, and Bev Harp, who's the associate director of communications and campaigns for the Medical Society Consortium on Climate and Health. And we're super excited to hear from each of them on the importance of turning out the vote, why voting is so important as a social determinant of health, and how we can press our elected leaders to do more. And along those lines, I just want to set a little bit of intention around why we chose to do this session on why voting is so important. And one of the reasons why voting is important is because we want elected decision makers who are passing bold policies on climate change. Although we've seen more and more support for climate legislation and climate solutions, we haven't seen that same sort of impetus within our decision makers. And the reasons for that are multifactorial. One of them is a big one, which is that the fossil fuel industry has really lobbied for votes and run public education campaigns that have really stymied action. And while climate change has enjoyed broad bipartisan support, unfortunately has become an overly politicized issue. A lot of our elected leaders don't often see this as an issue that's top of voters' minds. And we'll hear from Nathaniel Stinnett himself on what that's mean in terms of turning out the vote. We also understand that climate change will be one of the greatest determinants of health, which is why it's so important for voters to turn out, because the policies that our elected decision makers actually enact around climate change is going to really determine our health. And we know specifically that there are certain populations that have been underrepresented in the vote, that have been marginalized, where the policies that we pass actually ruin their health. And so it's extraordinarily important that these very communities be open access for these communities to be able to vote and turn out to vote so that the policies that are put in place are protective of their health. And with that, I'm going to first turn it over to Alia Bhatia from Vote ER to talk about their incredible program that actually I participate in, and I'm excited to hear from her.
Thank you, Lisa, and thank you to everyone here. It is such an honor at this pivotal and important time to be joining you. Before I dive in on the Vote ER front, I want to share that when we think about our work at Vote ER, we often look at the Medical Society Consortium on Climate and Health as a gold standard of some of the things that we want to be able to do as an organization and the ways that we want to lead and the ways that we want to collaborate with other organizations. And so I'm just really honored and grateful to be in this space with you because you represent a community that Vote ER is learning a lot from and hopefully able to bring some similar things into the world on the front of voting and health, similar to how y'all have been doing so on the climate and health front. So excited to dive in. In order to start this off, what I want to do is share a little bit of a personal journey of how I came into this work. I grew up in Atlanta, Georgia, have sort of strong roots in the Southeast and have worked all across different parts of the Southeast. And honestly, most of my work had been in education, housing, and private sector consulting. I was part of this leadership program where part of the requirement was to go on a ride-along with the emergency medical services and with the fire department. And so one December evening in 2019, I am on a ride-along with the emergency medical services in Atlanta, Georgia. And we are going around to kind of see where EMTs and teams of EMTs are meeting with patients and community. And what I'm noticing in that visit was that so many of the things that the EMTs were responding to were slightly indirect in terms of the health issue related. Oftentimes it was an issue of health that had arisen from homelessness. It was an issue of health that had arisen from the lack of availability of quality food. It was an issue of health that had arisen from a change in insurance for a person. And in seeing that, what my response was, oh my gosh, how overwhelming that health professionals are responding to climate, to housing issues, to food issues, to all of these different pieces in their roles. At the end of the ride along, I turned to the manager who's on duty, who's taking me around. And I say, there's a lot going on here. I'm pretty overwhelmed. If I gave you a magic wand and you had to prioritize, you could only choose one thing to change. What's the one thing you would change? And he said, Alia, I wish all my patients voted. If all my patients voted, then locally elected leaders would put money into affordable housing. They would put money into jobs training. They would put money into making sure there was a grocery store in every neighborhood. And when I had to get somebody an ambulance, I would have the funds to get them one on time. And he was sharing this concept of the political determinants of health in such a succinct and visceral way. I had never heard of the concept before. I was pretty surprised by his statement. And when I sort of went on in my life journey, about a month later, I hear about this organization, Vote ER, and I decided to get involved in the work that we do. And I'm excited to share a bit about that here. I'm going to do a couple sections right now, and then I'll come back to you later to talk about how to have conversations about voting with patients. To start with, a little bit about Vote ER. We are a 501c3 nonprofit, nonpartisan organization that integrates civic engagement into healthcare. We've expanded into over 500 hospitals and clinics and helped more than 47,000 Americans prepare to vote since 2019. Just as voter registration happens in your Department of Motor Vehicles, it should probably also be available in touch points that we actually visit more frequently, like health centers, like hospitals, like clinics that we are working in and spending time in. And so our work helps ensure that healthcare workers are able to bring this service that is so commonly provided in spaces like Departments of Motor Vehicles into more community touch points and trusted relationships, like in community health centers and hospitals. One thing that we know about what the law says around voter registration is that 501c3 organizations can conduct voter registration and voter engagement activities designed to help the public participate. And these can include voter registration, voter education, and get out the vote work, and supported by the National Voter Registration Act of 1993, as well as more recent precedents from Health and Human Services. Why do we do this work? Because it turns out that there are so many Americans who are eligible to vote, but have not even registered to vote. So many that they would fit in the population of Spain. So an enormous number of people whose voices are not being accounted for in the democratic process, and therefore not being accounted for in questions that relate to climate, and questions that relate to the environment, and questions at the intersection of climate and the environment and our health. And a lot of those unregistered eligible voters, or also registered voters who are not turning out to vote frequently, often lie at some of the same intersections of those we see in safety net health spaces. Often the young, those who are in low-income communities, or patients of color. And because of that intersection, it makes health spaces a particularly unique and ideal space to have conversations about voting with patients. We also know from reams of prior data, even before Vote ER existed, that when trusted nonprofit service providers are part of engaging people about voting, are part of it helping them register to vote, that we see higher turnout, both by age, by race, and by other demographics, when the nonprofit is the one serving them. And you see that particularly here with the bump that happens for voters who are of a younger age, of their excitement to participate in the process, and we see the same thing for voters of color as well. Altogether, Vote ER, works alongside doctors like Dr. Patel, and works alongside organizations like the sort of American Academy of Pediatrics, the League of Women Voters, Penn Medicine, countless hospitals and associations around the country. And it's together that we are making this movement around voting and health. So I want to dig into what was so apparent to the emergency medical services manager that later became more apparent to me in working alongside health professionals like you, which is that voting is as itself a social determinant of health. We see this at the national level, the local level, and individual level, and at the global level. And what you can see here, I'll put where you are in the chat. You can see where is your state. And you can see that generally more voting access in a state correlates to better experience, better self-reported health, also better maternal health outcomes, and a number of other health outcomes. And so that relationship holds both at the national level, the local level, and then also self-reported individual health. And to give you one example that I think is related to some of the work that y'all are passionate about, I want to take you to Southwest Detroit, where there are 24 and more industrial sites, and you see residents living 7 years less than the US as a whole. And you see asthma hospitalizations that are 2 times the level of Michigan and 5 times the level of what is average in the US. When you dig into the voting data in Southwest Michigan or Southwest Detroit, what you find is that across the state of Michigan, there are almost 5,000 election precincts. 41 of the 100 lowest turnout precincts are in Detroit. And of those, almost half are in Southwest Detroit, the same area where all of those refineries and sort of chemical facilities are located that are impacting the health of the community around that. So you see this correlation in this example of voting and health and how that impacts also questions of climate and the environment. We also see this when we look at the health outcomes for young children. When we look at the number of number of hospital beds that are of children being hospitalized versus voter participation at a very granular level. This is actually Ohio that you see right here. You see a relationship between levels of voting and levels of child health in community. And so the place that this is likely coming from is that the way that our system works is that if you are not registered to vote, you do not get a door knock from a candidate. And if you do not get a door knock from a candidate, you aren't encouraged to vote, and you also aren't encouraged to share your perspective on the issues. That creates a negative cycle where people who aren't voting don't vote, continue to not vote, their voice continues not to be heard, campaigns don't reach out to them to vote or to get their perspective, and you have this cycle that results in policies that are not beneficial to our most marginalized in society. And so what VoteER is part of doing is we're part of a broader movement with health professionals like you to try and reverse that impact of making sure that people are on the lists of registered voters, that they show up to vote, so that when campaigns are prioritizing who do they reach out to, they're reaching out to the same people who are crossing through emergency rooms, the same people crossing through community health centers, and getting their perspectives as to the important policies. And then those folks are voting and making those politicians accountable to them. VoteER is sort of both, folks like the emergency medical services manager who I met is recognizing this, but also recognized by folks who are in senior levels of administration in different hospitals. You can see here a quote from Bill Ryan, the VP of Government Relations at Einstein Medical Center, who said, VoteER plays an important role in addressing social determinants of health by meeting voters where they are and supporting them to be civically engaged. And the way that we think of this visually is we think of sort of health-related social needs as in the center. Social determinants of health is the next layer out. So let's take, let's say asthma as the middle piece, right, or the very densest piece of this. A social determinant that might link to that has a bus depot in their neighborhood that they've been growing up around that's been kind of, spewing contaminants that have led to asthma, right? But then upstream of that, there was a politician who decided it was okay for there to be a bus depot in that person's backyard. And that's where those structural determinants come in, is the structural determinants of health. We show that we see in the research that after controlling for demographic factors, that individuals also reported higher levels of personal well-being when they are voting. And then also see this in kind of the experience of depressive symptoms in young adulthood. And it turns out that the American Medical Association recently recognized this, voting as a social determinant of health, this summer at their national conference, now making that formally a social determinant of health. And that kind of began a domino effect where a number of other major associations have now also acknowledged voting as a critical determinant of health. So what I want to do now is talk a little bit about what are the things that VoteER offers organizations or individuals in this work, and how can you plug that into your work and advocacy around climate and health. What we do is we offer nonpartisan kind of issue neutral voter registration materials that allow you to have conversations with patients about voting. The QR code that you see there takes you to a landing page that helps people register to vote, get mail-in ballots. Right now, we'll also take them to information about campaigns and kind of who is running in their ballot and information that those campaigns have provided about people's stances and perspectives on issues, and then where and how to vote. We also provide posters, and then we also bring together people into little mini competitions where medical school students or social work students can compete around the number of people they engage around voting. Our tools are deliberately undestructive, optional, and nonpartisan. We know that as health professionals, y'all carry a lot of different things, and particularly right now in the not just aftermath, but the continuation of the COVID pandemic, that there's so much that you're carrying. And what we find is that our health professionals, because we've made these tools so simple, our health professionals actually say that it helps uplift them and support them in moments where they're not feeling hopeful in their work. It supports them to have hopeful conversations with patients about voting. What does that look like? This is Dr. Stager. She's a pediatrician in Ohio, and she is having a conversation with a patient. She talks to all of her 18-year-olds in her social history. Do you smoke? Do you drink? Are you wearing your seatbelt? Are you safe at home? Are you registered to vote? And then helps them, if they say no, helps them to finish their voter registration. The things that are within the bounds of kind of 501c3 and clinician capabilities, which you can say around this topic, is point people to the resources to do voter registration or receive voter education. Tell patients that this is offered as a service to register to vote, but that there's no endorsement of political party. You can also help the patient fill out the registration form while remaining neutral. And you can see here an example of one of our medical school captains who was already interested in the importance of voting and health. And in 2018, without the help of VoteER, got involved in this, was able to help 10 people register to vote. And then with VoteER, that spiked up to 500 people because our tools are simpler and fit right into their medical practice and their health practice as a part of what they were doing. As I mentioned, a lot of folks engaging in our work find this to be a way to increase their sense of connection to other health providers, to prevent the feeling of workplace burnout. Some of our health professionals have told us this is the work that I thought I was going to be trained to do, is really how to help patients in this way, and the experience of hopefulness. And then lastly, before I think I'm going to go hand the baton in just a second. But lastly here, so many folks who are using our tools see a direct connection between that and addressing these social and political determinants that impact patient outcomes. So I'm going to, as somebody who knows more about the broader voting and health, I'm going to hand it off to folks who know much more about the climate and environmental side of this, and then we'll come back with how do you actually talk to patients about this towards the end.
Great. Thank you so much for that wonderful overview. And we'll turn it over now to Nathaniel.
Great. Thank you, Lisa. And thank you, Alia. That was just such a cool and informative and important presentation. And I hope that some of the stuff I'm going to talk about can add some depth to that and take us in a climate direction. So as Lisa mentioned, I'm Nathaniel Stinnett, and I run a nonprofit called the Environmental Voter Project. And what we do is we work year-round to, excuse me one second here, let me just share my screen. We work year-round to identify people who care deeply about climate and the environment, but don't vote, and then turn them into better voters. We're in sort of the habit-changing business. I'm not going to talk much about our nonprofit's work today, but I'm going to use our nonprofit's work as a touch point a few times over the next 10, 15 minutes as we have a discussion about why it is important for people who care deeply about climate and environmental issues to vote. And then more specifically, some of our behavioral science learnings around what are the best ways in a completely nonpartisan, apolitical manner to message to people to make them more likely to vote. So let's start with the first thing. And fortunately, both Lisa and Alia touched a little bit on this, but I think it's so important to continue to drill down on it. And that is one of the biggest reasons that we in the climate movement right now cannot consistently get strong leadership at the federal, state, and local level is because there just aren't enough voters who list climate and other environmental issues as a top priority. And I know we don't like to admit that, like we in the advocacy space like to pound our chests and pretend like we're really strong and why isn't anybody listening to us? But the truth is we don't have nearly as much political power as we need to have. What you're looking at right here is a poll that we did a few months ago in 4 battleground states. Arizona, Georgia, Nevada, and Pennsylvania, asking people what their #1 top political priority is. And only 4% of likely voters listed climate and the environment, tied with people who list voter fraud as their #1 priority. We got to get it higher than that. Now, I'm sure many of you are thinking, oh, I see all these polls that say, a majority of Americans want government action on climate change. And you're not wrong. But there's a big difference between voter preferences and voter priorities. Yeah, a whole lot of voters and a whole lot of Americans would prefer that society take action on climate change. But when you drill down on what their actual strong priorities are, what their #1 issue is or #2 issue is, I don't care if you're polling for a Senate race or president or city council or anything in between, you are lucky if 4, 5, 6% of voters list climate as their top priority. And the reason this is so important is because even when we elect the so-called right people, it isn't like they can just snap their fingers and get whatever they want. They still need to decide what to spend their political capital on and what not to spend it on. And boy, is it hard to justify going out on a limb when only 4% of the people who show up in the elections you try to win list climate as their top priority. It's really hard. We have a dearth of demand in the political marketplace right now for climate leadership. And the reason this is so supremely important, and this touches on a great point that Alia made, is that whether you vote or not is of supreme importance to politicians and policymakers. So if there is just one thing that you remember from my little presentation today, let it be what I'm about to say. Who you vote for is secret, but whether you vote or not is public record. It is public record. And that one bit of information is quite literally the essential building block upon which all campaigns are run and all policy is made. Because take it from someone who has run dozens of political campaigns. If all I need to do is open up my laptop and I can literally see by name and street address all the people who vote in the election my candidate is trying to win, and all the people who don't vote in elections like that, who do you think we're going to talk to? And moreover, if we're only going to talk to the people who have a history of voting and say this gubernatorial election we're trying to win, well, who do you think we're going to poll to figure out whose priorities matter? Not the non-voters. Just like Starbucks doesn't care about you if you don't drink coffee. Like, why on earth would a politician care about you if they literally have a list showing them that you never bother to vote in the election that they're trying to win? No, they're not going to. They are going to poll the people who they know show up. And not to be creepy, but like they literally know those people by name and street address. And so that is why this poll that I showed you is so crucially important, but also kind of bad news for the environmental movement, because there's nothing secret about this. You poll any election from Boise to Boston or anything, and very, very few voters list climate and other environmental issues as a top priority. But it's not all bad news. It turns out, and this gets to why we at the Environmental Voter Project have this narrow focus that we do have, which is finding non-voting environmentalists and turning them into better voters. It turns out that the reason so few voters list climate and other environmental issues as a top priority is not because too few Americans do. It turns out if you step back and you broaden your aperture and you look at all Americans, or even all adults, or even all registered voters, there are many, many more of them who list climate and other environmental issues as a top priority. So why aren't they showing up in polls of voters like this? Well, for one pretty simple reason. Environmentalists are disproportionately awful voters. It turns out that the environmental movement has a bigger turnout problem than we do a persuasion problem. And as Lisa alluded to, What this means in raw numbers is that there are huge populations of already registered to vote super environmentalists who are just sitting at home on election day and not casting their ballots. And just like what Alia mentioned, registering people to vote is supremely important. It's also important once they're registered to get them off their rear ends and actually get them to vote in these elections. And just for a few data points, as you'll see here, in 2016, 10.1 million people who are already registered to vote, who our research identified as having a greater than 85% likelihood of literally listing climate as their #1 issue priority, they just stayed at home. In an election that was decided by 77,000 votes, 10.1 million registered super environmentalists stayed at home. And as you can see, turnout is lower in midterm elections, so this population of non-voting environmentalists is even higher in midterm elections. And to again align with a really interesting point that Alia made, there is this really interesting overlap, not only with the people who are least likely to vote and the people who are most likely to need medical care, but also the people who are most likely to care deeply about climate and the environment. These people you're looking at here, they are disproportionately people of color, they are disproportionately young, and they are disproportionately lower income. That is the beating heart of the modern environmental movement. We're not talking about like yuppies in Patagonia fleeces driving around in Priuses anymore. And so it is crucially important when these people interact with healthcare providers that we recognize, not just for reasons of voter representation, but also for climate policymaking and power building, this is a population that is undervoting. All right, so very briefly, once we identify these people, and I know I'm not getting into the details of what we do at the Environmental Voter Project, but we work with lots of data scientists and we build these huge predictive models, and I'm not going to talk about that. But once we identify them, then we are able to have completely agnostic messaging, right? Because at that point, we found people who don't need their minds changed. You shake them awake at night and these people scream climate change. They're just not voting. And so what we do is we run dozens of randomized control trials each year, figuring out which messages work best with which subgroups of these non-voting environmentalists, just to do one thing, and that is turn them into better, more consistent voters. And what we have found works, and I use we in the broadest sense, we're standing on the shoulders of lots of academics and other practitioners who are using behavioral psychology and behavioral economics techniques, is that broadly speaking, we should not be trying to rationally convince people of the importance of voting. And I know that cuts against so many of our urges. When you want to try to get somebody to do something, your urge is to say, okay, let me try to appeal to something that they care about and convince them of the importance of action X or action Y. There are a whole bunch of experiments for 30, 40 years that show that kind of doesn't work, because we're actually not these like cost benefit automatons like going around through life making these rational decisions. Instead, we are much more likely and much more often social animals rather than rational animals. And so the way behavioral psychologists have come to talk about this is the difference between what's called rational choice theory and expressive choice theory. 30 or 40 years ago, people thought, okay, if you want to get someone to take a particular action, you need to view them as a rational actor. So if they're going to vote, we could tell them, oh, turnout's going to be low because and that means that your one vote has a really good chance of impacting the outcome of the election. Now that's mathematically accurate, right? Like if turnout's low, the denominator's small, and that means your one vote does indeed have a much higher likelihood of determining the outcome of the election. That should be a really good rational message, right? That actually depresses turnout when you tell people that. That drives turnout down. Not only does it have no effect, it drives it down. If instead you say, hey, Lisa, everybody is voting, you've got to vote. Well, denominator is much bigger. Lisa's one vote in the numerator now has an infinitesimally small likelihood of determining the outcome of the election. That shouldn't work, but it does. It actually increases turnout as much as 2 percentage points, which is a big deal in this business. What I'm getting to, without trying to get down into millions of experiments here, is that what is a much more powerful way to frame your behavior change messaging is to, instead of rationally convincing people to do X or Y, you want to think about who are they, and perhaps more importantly, how do they want to be viewed and seen by their peers? And what that means is we end up using things like peer pressure and other forms of social pressure. Now I see some eyebrows going up, and I get it. I realize people think like, oh, that's yucky, that's manipulative. And no, not necessarily. And here's what I mean. Simply by sending a text message to these non-voting environmentalists saying 127 people on your block of Main Street have voted already, we can dramatically increase turnout. Now, yeah, is there something like juvenile and like 4th grade playgroundy about that? Yes, totally. But it works. And the reason it works is because we are social animals. We are constantly looking at others to figure out what is societally acceptable good behavior. And to not take advantage of that, if we're trying to change people's behavior, is crazy. I mean, if you could use some of these techniques to increase vaccination rates, would you? Of course you would. And so we should do it to increase voter turnout rates too. And so these even little techniques, like not saying it is important to vote, but instead of putting the emphasis on the verb, say it is important to be a voter, something that an English teacher would like put a big red X through. But by me deciding to talk about what kind of person you want to be, are you a voter or are you a non-voter? That kind of normative language is much more powerful because we walk through life trying to portray an image of ourselves to others. And boy, is it hard for me to convince you of the value of your one vote over a denominator of millions. But if I equate the act of voting with whether you are a good person or a civically engaged person or a responsible person, or even if I just say, oh, are you a voter or are you not a voter? That is much, much more powerful than asking people, are you going to vote? Instead of me asking them to assign a value to this one little action, I am saying, what kind of person are you? Or what kind of person aren't you? These are the techniques that have been extraordinarily effective in boosting turnout. And just to very, very quickly give some examples, we submit our work to randomized control trials. We were active in over 480 elections last year in 2021. In local elections, nonpartisan, sort of societal norm-based messaging like this increased turnout as much as 4 percentage points over our control group in local elections, and as much as 0.9 percentage, or I'm sorry, as much as 1.2 percentage points over our control group in statewide generals. These numbers might not seem like a lot, but ask Donald Trump how big a deal 1.2 is in Pennsylvania. Like, these are very, very big numbers in this business. And simply by altering the language that you use when you're trying to get people to change their behavior, and instead of saying, here is the value of taking X action, instead saying things like, would you like to be a good voter? You can really, really change things. And over time, this has an enormous cumulative impact. You know, EVP, we've been active in 17 states, but 5 of them we just recently went into. But those dark green states, there we've been active for a few years. And we have now communicated over the last 6 years with 8.7 million unique individuals, all of whom by definition were awful voters or we wouldn't be talking to them. And public voting records show that now over 1,030,000 of them are voting so consistently that they voted in their most recent federal election, their most recent state election, and their most recent local election. Voting is not a one-off decision that people make or don't make based off a cost-benefit analysis once every 2 years. No, it's a potentially habitual behavior, just like eating healthy or exercising is. And if we treat it that way, as something that people can be, rather than something that people can decide to do or not do once every 2 years, boy, is it much more impactful. And so I would encourage you in all of your practices and your interactions to think about talking about being a voter in this way, rather than trying to convince people of the value of voting in particular elections, not only because it is more impactful, but also that way you get to even be further away from like the icky partisanship stuff. Like, you don't want to talk about particular elections. That's the last thing you want to be doing. So instead, talk about this in the same way that you would talk about eating healthy or exercising, and the type of people your patients or clients would want to be. Because if you convince them that they want to be voters, or more likely they already have convinced themselves they want to be voters, and you stress that, it will be much, much more impactful. Thanks.
Thank you so much. That was super powerful and really helpful, I think, in terms of thinking about how we engage in this conversation, not just in a nonpartisan way, but in a really effective way as well. Thank you so much for that. And now we're going to transition to Bev Harp. She is going to talk to us about some of the candidate election resources that we've developed. Take it away, Bev.
Yes. So after this, Alia is going to talk more about how to engage patients. But now we're going to talk about how to engage candidates, which is also very important. A smaller population, but obviously one with a fair bit of power. And just like Nathaniel said, we and you all with your trusted voices as health professionals are going to convince them that they want to be, they actually need to be for their, chance at winning their election, a climate and health champion. So we are more of a policy focused organization. So we put together some guides on how to engage candidates on these issues. So I'm going to walk through them quickly, and I'll drop the link in the chat so you can go back and look at these. And we will also be hosting a webinar, a workshop webinar, a week from today, next Thursday at 6 p.m. Eastern, to work through some of these resources together and write op-eds to local newspapers saying, what kind of candidate we need, what kind of issues they need to be strong on. So we'll start here with our first resource is a dozen questions every candidate must answer, but we made it a baker's dozen. There's 13. So we put together what we see as the top 13 questions that we could be powerful asking candidates. And so these cover topics like active transportation, like, do you have a plan for disaster resilience? What are you going to do when you get into office about these issues? So we present the question that would be impactful to ask, and then we give background on why this policy issue is important for climate and health and what kind of strong answer you should be looking for from a candidate. So we cover, like I said, transportation, clean drinking water. We tried to look at what the top priorities are for our elections this year. Big one is the implementation of the Inflation Reduction Act and the Infrastructure Investment and Jobs Act. How are you going to ensure that all of this money is used well? What can you do at the federal level or at the state level to make sure that this is a strong implementation and that we don't spend billions of dollars on highways or other polluting infrastructure that we know we don't need. So I won't go through all of them, but I hope you will take a look at this. I would say that this is also a very good policy backgrounder on these issues. If you just, if someone's like, well, what are you concerned about this election? Reading this document, I would say you'd have a very strong background and response to say, I'm concerned about these issues. I'm, as a doctor, as a nurse, and someone who cares about climate change, I'm thinking about my kids' future. Here are the issues that are concerning me. So this great document. And so you're wondering maybe, how do I use this document? How am I going to get candidates these questions? Last 2 years ago, the last big election season, 2020, one of our state leaders in Michigan sent this out to every candidate in her state, which was amazing. And getting this on, candidates, they're looking at their numbers, they're seeing, who in this community cares about these issues, and why should, like Nathaniel was saying, they're looking at those and assessing how strong they should be on issues, and if this is a good issue to be strong on. And if they hear from a leader in their community, a physician or a nurse who's interacting with lots of their potential voters, that matters. That's an important voice. So in addition to being, you can actually use these questions at candidate forums, which there should still be a number of coming up leading up to the election. We have another guide I'll show that actually outlines how you might go about finding a candidate forum, and how you might register for one. And if you're feeling really ambitious, you could host your own. If you have unlimited energy to engage in this election season. But we also have a guide to help you. You can take one or two of these questions, maybe a couple policy issues that really relate to maybe your area of practice, or just an issue that is important in your community. And you can take all of the policy background information that we come up with, or even just the questions, and write an op-ed. So we have this op-ed template that we've created, and some of you may be op-ed writers already, but if not, no worries. We have a good template that, shows you, here's where you put your personal story, and here's where you say, here are 2 questions from any candidate who wants to represent our district that they need to answer. They need to be accountable for the climate and health impacts of their policy decisions. So we've tried to really create some guides that will make it easy for you to engage. And this really matters, that, everything we're talking about here, as much influence as we can exert in our local media templates and outlets, in candidate forums. We know there's so much money being poured into these elections. So the more we can do at a grassroots level to engage people with voices that are trusted, perspectives that are trusted, the more, possibility we have of winning elections that have positive outcomes for our health and our climate. And now I'm just going to quickly review the second resource we created here, in addition to the candidate questions, which is an open letter to candidates. And this is something that you could also send directly to the candidates running for office in your district or all over your state. And this is us trying to say, hey, candidates, why would you, want to be strong on climate and health? And our argument is, like Nathaniel was saying, it's actually a really important issue with lots of public support. And, I think the argument of a lot of the climate movement is, if candidates come out stronger on these issues, they will find more support, because the numbers are there. The American public reports all sorts of climate interventions and solutions. And so this letter outlines to candidates why they should care about these issues, and how they suggest how they could frame some of their stances. So we are trying to help candidates be the best they can be on climate and health policy, with the argument that will make them more popular and make voters more energized to vote for a candidate that has a serious plan on climate and on protecting the health of their community. So the document goes on, the letter, and then we even give them examples of different climate and health statements they could be making. So like I said, we had someone in our active state groups, we had folks send this to all of their candidates. And I hope you all will consider doing that as well. Like I said, the more, voices that we can get to those running for office and let them know that these are issues their community cares about, the more likely they're going to be to act on those issues. So there'll be time for questions a little later, I think, or maybe right now, but that's all I have to share on our resources.
Thank you so much, Bev. Yeah, and we'd encourage you, to the points that both Nathaniel and Alia have made, and Bev has made as well. Each of the individuals on this call, each of you has the opportunity to show that this issue matters to you as a constituent, to your decision maker, and as someone who interfaces with constituents in a really intimate way that decision makers respect. If folks want to drop some questions in the chat for the speakers, and while people are thinking of their questions, I have a few. Alia, I'll start with you. I'm just wondering, I love VoteER as a tool. I'm also wondering, are there more things that health professionals can do that's more structural to improve voter access, particularly in areas where there's been active voter suppression?
Yeah, amazing question. A couple things. The first is, let me speak specifically to some of the things that our tools support, and then I can talk a little bit more about what does VoteER do on a policy front. As it relates to some of the things that we do, it's funny because the way that we talk about it is, hey, you've got this QR code, and then the process for patients is really simple. The reality is that the magic is actually the conversation that's had, and the trust that it builds around the importance of that conversation, and the trust that comes from having that conversation with a health professional. And what we find is that because of the voice that health professionals carry, when we look at our 2020 data, when we look at partners who have been doing this long before us, we find higher levels of turnout when the messenger is a health professional. When you think about the loop that is voter suppression, right? It is things are done to make it harder for people to vote, or make it so that people perceive less value to their vote, and then people don't vote, and then the cycle continues, right? There's an important way that actually the direct intervention of conversations about the importance of voting, and conversations, as Nathaniel mentioned, of like, this is what people like you are doing, is they're voting to have their voice heard. There is a way in which that is a part of disrupting the system of voter suppression that we have to keep in mind, is that you have to restore the trust around voting in order for it to become an effective mechanism to address broader voter suppression. So just want to first name that voting itself is a part of making sure to break that cycle. As it relates to the work that VoteER does, we're strictly a 501c3, so we don't engage in anything that is lobbying. With that said, we did work with a coalition of organizations on some executive branch work, helping Health and Human Services restore voting as a social determinant of health, helping HHS put out guidance around how hospitals and community health centers could do voter access in their spaces, kind of reconciling the laws and legal framework in a way that worked for people. So we work, pretty directly with Health and Human Services around the containers and the guidelines in which it can support voter access. And then looking further beyond, we're just starting as an organization to think about what is the next stage of policy work for VoteER, and what are the pieces of that voter suppression loop, or just more generally the impact of a person's vote in general, and how that contributes to voter suppression, and where VoteER is going to go with that. And we're really excited for what the future is going to look like in terms of our policy plans.
Great. Nathaniel, the next question's for you. I'd love to hear a little bit more about how EVP works in terms of turning out the vote.
Yeah, so we have thousands of volunteers around the country who help us canvass and call and send postcards to these non-voting environmentalists. We also send direct mail and digital ads to them. And it's essentially a three-step process. So identification, mobilization, and then habit reinforcement. So identification, and I won't drill into too much detail here, but if what I describe is of interest to you, you can certainly go to environmentalvoter.org and learn more. We build predictive models on voter files that enable us to individually identify people who have a high likelihood of listing climate or other environmental issues as their top priority. I know I just said a mouthful here. First, let me just say, these are the same techniques that sophisticated Senate and gubernatorial campaigns now use to target voters. If you have in your head that like campaigns go after demographic groups like soccer moms or NASCAR dads. Like, forget about that. It's not how anybody targets people anymore. Instead, what they do is they will poll tens of thousands of people, figure out what issues people care about, and then work with data scientists to find more people like them. And kind of like an insurance company building an actuarial table, we build these probabilistic models that help us assign really accurate scores to every voter in a voter file. And we can say, oh, Marianne Smith at 123 Main Street has a 92% likelihood of listing climate as her top priority. But we know from public voting records, remember what I said, whether you vote or not is public record, we know from public voting records that she never votes in a midterm. And so we can go get her. We know now that Marianne doesn't need persuasion messaging, she just needs behavior change messaging. That allows us to go to step 2. It allows us to bypass the hardest, most expensive part of politics, which is changing people's minds, and instead go right to behavior change, which of course is not easy, but it is easier. And perhaps more importantly, you can experiment and figure out which stuff works. And so that's when this behavior change messaging that I brought up comes into play. We run tons of randomized control trials, and in all of our messaging, whether it's from volunteers or our direct mail and digital ads, we're using this behavioral science informed, apolitical, nonpartisan messaging to turn these folks into better, more consistent voters. And we need tons of volunteers if you're interested in making calls or doing other things or knocking on doors. And then the third step is habit reinforcement. You don't need to be a behavioral scientist to understand that you can't just parachute in once every 2 years when there's a big federal election going on and assume that you're going to change someone's behavior. That's not how it works. And so we work in hundreds of elections each year because we really view every single one of them as an important behavioral intervention opportunity. Now, do all of those elections have anything to do with environmental policymaking? No. In fact, most of them don't. But every single one of those elections has to do with changing people's behavior. And so again, to use like an exercising analogy, we want to take every opportunity to make these people go to the gym or eat healthy or things like that. And so even if there's a dog catcher election going on or a special DA's primary, you better believe we're going to use that as an opportunity to turn non-voters into voters, because our end goal is 2, 3, 4 years after working in a state to make it so that any politician running for anything says, holy moly, where did all these climate voters come from? Because at the end of the day, politicians need to go where the votes are. It's the brutal arithmetic of how democracy works. Like, either you go where the votes are or you don't get to be a politician anymore. And so if we can dramatically increase the number of climate voters, not non-voters, but voters, it's really going to start driving policymaking.
And look, both Joanne and I are trying to do our societal norm messaging in the chat. As we're volunteering with EVP, you should join us too.
I love it.
Alia, another question for you, and I think this gets a little bit at what Cecilia put into the chat here, and a question I've heard often is trying to stay nonpartisan. So let's say you get engaged in a conversation with a patient around voting, and then they ask you, well, how are you voting? Which candidate are you voting for? What's sort of some advice around how to handle that?
Yeah, love the question. So what I think might be counterintuitive is that, so the first thing is, let's talk about VOTR and nonpartisanship. Let's start there. VOTR and our work, our terms of use are all hinged around the importance of maintaining nonpartisanship. Why? Yes, there's absolutely the legal reasons related to being a 501c3, and it is more effective. You just heard from Nathaniel, when people only see themselves being turned out to vote in even elections where people have a D or an R or a magenta or a yellow next to their name, right? They know that they're just being used for that one election. And so it's critically important, actually, in the messaging around turning people out to vote. It's critically important we do it year round. And it's critically important that we do it in a way that does not suggest that one party is better or different from another, but rather that the most important thing is that people show up and vote their conscience so that they are part of who is holding accountable those leaders of the future. So I want to just start there with the foundation of doing this in a nonpartisan way is the right way to do it for a lot of different reasons. It's going to be more effective if we do it that way. And also it will support the things I'm going to follow up with around what happens if a patient asks about a specific candidate. There are two takes that you could go down. If you have a really good relationship with that patient, you can be a little bit kind of like in that relationship, say something that has to do with that relationship, which is, I'm voting for you and your health and making sure that, you know, your policies are taking care of you and your health. And like, that's what I'm voting for. That's like an indirect way of not giving an answer to the question. What you can also do is if you don't feel like that's your style, right, or don't want to have that type of conversation, you can say, look, a lot of people talk to their friends and family to learn about who's on the ballot. You know, this QR code will tell you a little bit about people already listed on the ballot and the positions they've taken, and you can look them up there. But I really suggest that you make that decision for yourself and use whatever resources and information that you can hear from those around you, and that you can hear from these nonpartisan resources. And so it's like, either say it's important for you to do your own homework, or the way in which you deflect the question, put the patient at the center of how you're going to be thinking about your decision. I think is the two ways that we recommend going around the question.
I see this question from Mary. Mary, would you like to come off mute and ask your question?
Sure. My question is there any evidence to suggest that voter turnout is better in states like Washington State, where all the ballots are mail-in, and should we be pushing towards that sort of situation?
Nathaniel, you want to start, or you want me to start? I'm good.
Sure. I can start. Yes, there is evidence, but as you can imagine, Mary, you can't really run controlled experiments in situations like that. And so it's not the most scientifically rigorous evidence. But when we look at Washington, Oregon, Utah, Nevada more recently, most elections in California, yes, when you mail all active registered voters ballots, turnout goes up. Is there a very, very clear causal relationship from randomized control trials? No, but we've yet to see turnout rates go down when ballots are mailed, that's for sure. And there's a lot of reason to believe that there is a causal relationship and that it does go up.
And the thing I would layer in there is that, when we're thinking, as I mentioned, we're looking ahead for VOTE-R, what is our sort of policy, focus in the future. And one of the things that we've been thinking about a little bit is that universally mailed ballots addresses a really critical health issue around ability, disability, how that impacts your ability to vote and your access to the vote. And so in addition to most likely increasing the number of people and percent of people who turn out, it also impacts a set of accessibility things that probably matter to a lot of y'all in this room. So it's probably an important lever as we think about better aligning health and voting in ways that row in the right direction.
Great. Any more questions from folks before we turn it to the breakouts? Okay, Alia, I'll turn it back to you for our breakout sessions.
Thank you. Y'all, this is the perfect setup because going after Nathaniel and going after Bev means that you've heard a lot of the why behind everything we're about to share with you. I'm going to layer in one more piece. My sections now is going to be, how do you actually talk with a patient about voting? I'm going to layer in one more piece. You heard from Nathaniel a lot about the social proof component of talk about the fact that everyone is doing this. And I'll show you that when we talk about how particularly to talk with young voters. There's another component that is often at the heart of where people's frustration comes from about this process. And it's that other part of the voter suppression group, right? Is like when people make it hard to vote or diminish the power of a vote, we then perceive that we don't have a power that we actually have. And sometimes we give it up. So the power question is another one to really be thinking about in terms of frames of conversation. So I'm going to give you two conversation frames and then build the rest off of that. And then we'll go into some breakout groups and get some practice together and I'll be with you. So, all right, so how to talk about voting with patients and clients. First thing here is that you can find everything that I'm about to share at the VoteER website. It's just, I'll type it into the chat here in case you like to follow along in a tactile way, voteer.org/scripts. So you can find our materials there. We developed these in partnership with a Black-owned polling firm that has done a lot of research on turnout amongst communities of color in particular, and so built these in combination with them. And what you'll see is that they leverage two different framings. I'm going to start with the power frame, which is a little different from Nathaniel's frame that he shared, and then I'm going to move over to the frame that he did share around the get on the train sort of perspective. The train is moving, the right thing to do is to be on the train. So this first conversation starter is one that you can do with basically any voter, right? If you're like, I've only learned one way to talk about this with patients, you could do this way with patients. The first thing is, and you decide, you will, as a health professional, you will know, are you put the full conversation out there? Or you put a tidbit of it out there and then explore with the patient in dialogue? That's a part that you will know better for your style. What we recommend is that you start with a very simple question, which is, before I leave, I'd like to check if you're eligible to vote and registered to vote at your current address. I'll give you an example of where I've seen this done. I was shadowing an ER doctor who was doing some work on the low acuity side of the ER. And this young lady had tooth pain. And at the end, Dr. Bhatia approached this young lady and said, by the way, one thing that we do with all of our patients is also double check if they're registered to vote at their current address and ready to vote in upcoming elections. And by pointing out that it's a routine part of what they do, it makes it a really simple conversation to have. Oftentimes the conversation ends there, the patient's face lights up and they're like, yes, doc, I'm ready to vote. And it's like this beautiful thing of they didn't expect the question, and it's a gift to them that they get to talk about that with their health professional. Now let's say that there's a little persuasion needed. One way of doing that is to talk about the vote as a powerful tool to address and improve issues you care about, like your health. Talking about the fact, very kind of going back to Nathaniel's point, framing this in context of elections where their vote has clear and identifiable power, local elections that are often decided by a small number of voters, it does two things. First, it talks about the value that their vote has, but second, it moves away from the cynicism that can be associated with more than national hyper-partisan election scene that's like just focused on national elections. And so it really gets down to that person's community. Through your vote, you have a say on issues like prices of medication, the cost of health insurance. Y'all may have environmental pieces to plug in there as well. And then the last thing for VoteER is, because we've tried to make our tools as simple as possible, we try to have you close the conversation by saying something like, all you have to do is point your camera at this QR code or text this number, and we'll help you through every step of the process. And what we've got is we actually have a helpline on our tools, because as a health professional, you can't be an expert on voting in the same way that you need to be an expert on health. And so what we try and do is provide a support to make it as simple as possible, that if they have extra questions, that they can go there. So this is one frame, which is the power frame. And if you only remember one frame, this is one that you can remember. And then there's another one that I'm about to share more similar to Nathaniel's. So let's talk about young voters. When we talk about young voters, one thing that is important to remember is that they actually have times moved the power of gravity within politics and policy. And it's important to reference back to those moments to remind young voters why their vote is so, so critically important. Starting with the same place, before I leave, I'd like to check if you're eligible to vote. If you're a pediatrician, this is a routine thing for 18-year-olds. Hey, you are turning 18, we've got all these things to talk about with your body. Let's take a second and also talk about how your agency is changing. As a young person, you have more power than you might think. In 2020, recent election, young voters like you made history by setting voting records. This is the train is moving, get on the train sort of perspective, right? Your vote allows you to create changes you want to see in your community. And then here's how simple it is to move this to get started. Similar conversations, gonna spend less time on these, but in talking with parents, this is particularly important because younger children cannot vote, and so it's really critically important that parents vote. We actually have data that parents of recently born, so newborns, are likely to vote at a lower rate, likely because of the time that is needed in caring for a newborn. And so it's really important to remind those folks that if they don't vote, then their voice isn't heard in the shaping of policies that will shape their child's future. And so reminding them about looking forwards to what they want their child to experience. Now, when you get that enthusiastic person, these are the best folks. One way is just, great, thank you for being a voter, right? It's the be a voter language that you heard from Nathaniel. The other way to continue that conversation is to remind that person they are a far more powerful messenger than any robocall or cold text that anybody in their community is going to get. And so if they're really enthusiastic, say, just a reminder that one of the most effective things that you can do is talk with your friends and family about the importance of voting and make sure their voices are heard, because they're going to trust that person far more than they're going to trust the random, I'm from Georgia, I'm getting them now, right? Here's my phone, right? I'm getting these calls now of show up to vote. These people don't know me. Somebody telling me who knows me to vote is a really critically important part of this. And then the last thing is, y'all asked about the partisanship. One way that a patient might say that is, well, doc, who are you voting for? Or, who are you voting for as my health professional? Another example of how that can come up is, my vote doesn't mean anything. I don't have experience with it meaning anything. You can, in that world, talk about the importance of local elections as one way to do it. You can also take a second and ask them, can you remember a time that policy impacted your life? Can you remember a time that something did change for the better? And you can take them down that path as well. I've seen people on my team do that really well. That's not my forte. And so I usually go more with the script of like, let me just tell you about how important your vote is, but also remind them that you're not making a decision for them. It's their choice whether to register to vote or not. You just want to make sure they have the information they have to make the decision for themselves. So with that, we are going to go into breakout groups. In the breakout group, use your first name to figure out the following. I'll put this in the chat as well so that it carries with you into the breakout group. First, introduce yourself. Take a second to say hi. Oh, Haley, you rock. Thank you. Thank you so much. If you're first alphabetically, you're going to start as the health provider asking about voter registration. If you're second alphabetically, you're the patient, and then everybody else is observing and giving input, and then you can rotate. Ideally, let's try and do it where if you speak first, the folks who haven't spoken get first priority for the second round of simulations, and then we'll probably come back together after kind of 2 rounds of that. So looking forwards, and I'll be in there with you.
Facilitate some kind of.
I had just one reflection, which is I reminded myself that this group includes quite a global group, and so I had 2 quick thoughts. The first is that our tools obviously only work in the US, and also the link and relationship between voting and health spans kind of, we've got global evidence for it as well. And there's a really interesting instance in Brazil where they were switching over from paper ballots where you to be able to legibly write a candidate's name over to electronic voting. And some places got it before others, and the health impact of getting that new system was actually pretty immediate around spending and investment in public health. So just to name those of you in global settings, there is this link there. I regret to say our tools will not work there, but just hearing how a reminder of how some of the challenges that American health professionals are experiencing are universal in terms of how climate is impacting health was really lovely for me to take away from our little conversation. So.
Great. Any other reflections from some of the groups in terms of initiating the conversations, or any little thorny issues that came up that y'all had to work through? Don't be shy. There are only 30 of us. Has anyone used VoteER before? Everyone's new to it?
I'll just share from our group, if I may. One of the questions was at what level, staffing wise, would this be implemented, or could it be? And we talked about, intake support staff hitting a lot of patients, maybe being ideal, even posting the QR code on the wall so it's there and people can't resist to scan it just to see what it takes them to.
Actually, that's a great question, Alia. Are there sort of systems level practices that VoteER promotes beyond just the physician carrying or a health provider carrying a badge?
Yeah, great question. We do this in two different types of settings. If, for example, in clinics, Oftentimes for community health centers, they have text messaging systems for appointment reminders, programming reminders. And we actually work with clinics to include shortly before kind of upcoming election deadlines, like registration deadlines, a note about, hey, as part of our regular sort of like work, we want to check in and make sure that you're registered. You can do that here. And that way it's going out to everyone at once. It doesn't require time on the part of the health professional. That's one example of embedding into systems. Another example is, like you mentioned, at intake. And there's like one version of this that keeps, I think the relationship piece and the trust piece is important to try and keep. So there's one piece, which is that the person facilitating intake asks the question. There's another version of it, which is we work with one of the EMR companies, Frisia, to integrate it straight into the intake process for their patients at Einstein Hospital in Philadelphia. And so every patient that comes in through their ED as part of the intake process is nudged and reminded about voting and voter access. When you can build it into a systems, that's helpful. And it's still useful if there's a way for a health professional to be part of the face of why you're asking the question, so that trust component that's so valuable to the trusted messenger piece of this kind of remains in place.
Great. Any other reflections or questions or thoughts?
I did use Vote ER in residency. I'm a ER attending now, and so I used it at like about 1.5 years, 2 years ago. I feel like I have like a little bit of a new perspective after this presentation and talk, and just like, I think I was like just focused on, all right, registering people who are not registered. And I kind of missed the opportunity to find those people that are also registered. The conversation doesn't have to end at, yes, I am registered. Okay. But like kind of being like, oh, you're a voter. Great. To like, really encourage them to, to get out there. And I think, I feel like just having, I have to get a badge for this month. But yeah, I think I want to start having these conversations again, because I think it's definitely beneficial, just even beyond getting people to vote. But yeah. Yeah.
Very quickly, the evidence is really clear that even if people have already registered, asking them about voter registration makes them more likely to vote in the next election. So it's actually helpful to even have the conversation about registration. And then if they say yes, like just saying, okay, and then are you actually ready to vote in the upcoming election is like a good follow-up. So thank you.
I think my big takeaway, oh, sorry, go ahead. So.
Oh, this is just to piggyback onto Alia's, and I call them, as in meeting with Helen from Canada, some other guerrilla tactics at the systems level that we all have access to. It's also our email signatures. So you could have the ones that, that auto-generated for all staff. And obviously time limited, during kind of peak get out the vote season. And then the other was our whole time messaging. That's something that we used a lot during COVID. So they've got those, you've got, maybe, 10 seconds to 15 seconds that you could have on loop for when folks are making calls, where it's just, and then also with those televisions, if you have, depending on how many monitors, you could actually dedicate several of them and just cover them up. And put the QR code there, because again, it's that captive audience moments of, I guess we'll call it this, that desert island opportunity.
I see we're at time, and it sounds like, Alia, you have to go. So thank you so much. And thank you all for joining us. And next week, we have a super exciting panel from advocates in lots of different spaces, sustainable healthcare, our state clinician groups. And so we're looking forward to next week to carry on with this conversation. Thank you, everyone, and have a great week.